choose home when care is needed, a podcast all about the value and benefits of receiving care in a place that you likely feel most comfortable, wherever you call home. I'm your host, Marilee Orsini, and I've been involved in healthcare at home since 1981. Each episode, I'll be talking with a guest who will help us in our quest to educate about healthcare at home. So let's get started. Today's episode is number 8, and our guest is Matt Hughes. Matt's Vice President of the Accreditation Commission for Healthcare, which is called ACHC in the industry. It's a nonprofit accreditation organization, and Matt has been involved in healthcare for most of his professional career, so I think you will enjoy today's guest. Matt, thank you so much for joining us today. And you come from a component of the industry, the accreditation side, and that is really something I felt like consumers of home care should know about. So can you just in a nutshell tell me what's the difference from a consumer standpoint, from an agency that would go through the process of accreditation versus one that would not?
Absolutely. And yes, thanks for having me on. And today I think that, especially from a consumer standpoint, accreditation is becoming more and more vital as more and more facilities, agencies, organizations that are providing health in the home. I think it's more and more important that the industry and that we as a society have trust in the organizations that are providing that care, and that's really what accreditation does. It adds a level of it allows consumers to feel comfortable with the care that's being provided to them. We are going in and ensuring that organizations have proper staff, that they're properly trained, that they have been, the quality of work that they're doing in the home is meeting our requirements, and just that they're following the procedures that meet our standards. And I think that when they can demonstrate that and we have acknowledged that, we'll give them our stamp of approval. And when a consumer sees that stamp of approval, they can be assured that we have done that work, and I think that their level of comfort is better.
And we've, in previous episodes, talked a lot about the silos of care and the different models of care. ACHC actually accredits all models of care. Am I correct in that statement?
We focus today on the post-acute. So today we accredit 8 different programs. That is home health, hospice, private duty, home medical equipment, pharmacy, sleep labs, ambulatory care, and behavioral health.
Goodness, that's an expanded list than what I thought. So let's focus just on home care and home health care, which would be home health care, hospice, and private duty. So agencies that come to you and want to be accredited, are there minimum standards they have to meet in addition to your ongoing rigorous standards?
Yeah, so today we have ACHC has what's considered Deeming Authority, and so we have developed standards that incorporate kind of the national regs that have been created by the Centers for Medicare and Medicaid Services. So they do incorporate those standards, but we do have standards that go above and beyond. But being that we have that Deeming Authority from CMS, it allows us to conduct the surveys on their behalf. So if a new agency wanted to get into the industry, they have to go through an accreditation organization such as ACHC in order to participate in Medicare. So we do have standards that go above and beyond that they do have to meet.
So from a consumer standpoint, how would someone, when they have a loved one with a care need, how would that person be able to determine if an agency is accredited?
Yeah, that's a great question. There's a couple of different ways. I think that especially if they're being discharged from a hospital and they're going home, and the folks at the folks at the hospital that are discharging them are sending them home with some sort of a home care. They're obviously going to give them options, and with the patient being able to have that options, I think asking the question is very, very important. Is this an accredited facility that you guys are working with? They also can do some due diligence ahead of time if they wanted to look up on ACHC's website, and you can certainly search all of our accredited facilities on our website to ensure, and you can do it by proximity. So if you are in, let's just say, for example, Asheville, North Carolina, and you wanted to see the accredited home health agencies or hospices in Asheville, North Carolina, you can do that search while you're in the hospital and choose one that is accredited.
And are you talking about doing that search on the ACHC website? And what is that URL?
It is www.achc.org.
Pretty easy and simple then for someone to understand. Would the hospital discharge planner necessarily understand the difference between an accredited and a non-accredited agency?
I think they would today. I think that because accreditation is becoming more and more vital, and I think that with the education, and that's a huge component of what we're doing, is trying to share the value of why get accredited and why it's so important. And I think that today we are reaching audiences. I think we're reaching the consumers. We are reaching the actual providers, but then we're also reaching, I think, also hospitals. We're seeing a lot of health systems or home health and hospice agencies that are tied to a health system choosing ACHC as their accreditor of choice, which we think is fantastic, and it's a growing market for us.
Give me a little bit of history. I know that ACHC has been accrediting since the mid-'80s, I believe, 1986.
That's correct. We actually started in North Carolina. It was a group of providers here in North Carolina that wanted to develop standards that were really focused on the community-based care, and at that point there weren't a lot of options. They wanted to create a new option for providers and also for consumers, and so we were very small as we grew, and in the mid-2000s and 2006 is really when we received our Deeming Authority for Home Health, and then we received our Deeming Authority for Hospice in 2009. And once you have that approval, that's really when things start to take off. And today there's obviously different accreditors and that are approved by Medicare. There's 3 actually, and one of the approaches that ACHC took was really the collaborative approach that we take with our customers, and the consultative approach that we take with our customers. I think that by having that partnership in order to, in essence, make their organization better and make the level of care better, ultimately it's going to benefit the patient on the back end, and that's our philosophy. Obviously, if they're not in it for the right reasons, we're going to be able to identify that, and if they're not accredited with us, we obviously can report that back to the stakeholders. But I think that folks that are accredited with ACHC, we can be assured that they are providing that level of care, and in the end, ultimately benefits the patient. So I think that the history of the growth is really and has really taken off, and I think it's that philosophy that we have embraced by really partnering with our organizations and ensuring and holding them accountable to our standards, and not not bending on that, and because we take this serious, because we know that there are people's lives at stake, and so if we do our job correctly, then we can be assured that those agencies that are accredited with ACHC are doing it correctly.
I want to make certain that I understand Deeming Authority, because did I hear you say that with this Deeming Authority, you are able to do the surveys, and you in place of Center for Medicare Services?
That's correct. So there are a couple of circumstances. So today, again, there are organizations that are not accredited, and we refer to that as they are still under the state's authority. and there are other agencies that are deemed within an accreditor like ACHC. That means that they are under our authority, which means that if they continue, and accreditation is good for 3 years, so if they continue that accreditation and remain under our authority, the only time that they would get a visit from the state or from Medicare is if there was a complaint that came in that the state chose to investigate themselves. Now, a lot of times they may send it to us, and we'll investigate it, but they have the choice to go in and investigate a complaint on their own, or it is a validation survey. And what a validation survey is simply they choose a percentage of providers that have received deemed status surveys, and they're basically checking behind the accreditor to make sure that we did our job properly.
So it sounds like a multi-level system for making certain that the services that a consumer is receiving in their home from a home health company, that there are multiple levels of people checking to make certain that the care is appropriate and adequate and meeting the high standards.
Sure, absolutely.
Prior to being in accreditation, Matt, you served in the healthcare industry.
Actually, April will be 11 years with ACHC, but prior to that, I came from the provider world. When I started my career, I actually started it in home health care. I actually had a home health nurse that was living on my street that introduced me to an organization in North Carolina. So I began working with them on the reimbursement and billing side of things and kind of learned the business that way, and then started working my way up through management and just really was exposed to the home health and to the DME and to the pharmacy world, where then in 2007 I came on board with ACHC on the accreditation side.
We use a lot of acronyms in this industry, and oftentimes the consumer doesn't understand acronyms. So you've mentioned DME a couple of times. I know that's durable medical equipment, but so if someone who is offering durable medical equipment, which also oftentimes accompanies a home care stay with a health care at home, what types of things are you accrediting in DME?
There are actually some standards that have been required by Medicare, and in 2009, the Centers for Medicare and Medicaid Services actually put a requirement in place that all providers that are billing Medicare Part B must be accredited. So that is really your again, durable medical equipment, your hospital beds, your wheelchairs, oxygen. If you're going home on any sort of or any type of this equipment, you're going to be getting it from a facility, and we again have to make sure that those facilities are meeting both the Medicare requirements, and then we have ours on top of that, the more stringent ones. And we're really looking at things like the training that takes place. So the training with the patient, making sure that there is processes in place when equipment gets returned, that it gets cleaned and it gets all that's done properly. So again, ultimately affecting the patient, we want to make sure that they have those procedures in place so that they are doing that, meeting our standards, and really to the level that we all expect.
I have a question from a consumer standpoint in terms of if a consumer had an unsatisfactory experience. So say either with medical equipment that came into the home or with the provision of service from a home health company. What does the consumer do at that end of the spectrum?
It's a great question. So I can tell you that from an accreditation side, if the facility that they're receiving services from is accredited, one of our requirements is that when you introduce your organization to a new patient, when you bring on a new patient, you obviously are providing them with a welcome packet and all the information about the care that they're going to be receiving. One of those requirements is listing us as their accreditor and as a resource to the consumer. If they have problems, they can call us as the accreditor. So we actually have a very robust process internally where we take those calls quite often, and we escalate those to determine if we have to go back out and do another survey. We require information. So we absolutely will investigate any of those concerns or complaints that a consumer may have to ensure that the organization either fixes it, or if they do not, it ultimately could be them leading to losing their accreditation and report it forward. If they are not accredited, then it's really unfortunately it's up to the consumer to try and find who the next best group is to lodge that complaint. And I would assume that it would be to the insurance company or whoever is going to be kind of paying that claim. So it can be confusing, which is again another benefit from an accreditation standpoint. They have a resource that they can go to if they aren't receiving the level that they expect, that they have somebody to report that to.
Goodness, it's always amazing to me how much more complicated it is to get older and need health care at home than to have health care at home when you're younger. It seems like a lot of moving parts here. Is there anything that I haven't asked you that you feel is important for a consumer to know that has to do with accreditation or reporting or receiving service?
I think that as healthcare continues to grow and as healthcare at home continues to grow, I think it is going to become more and more vital for consumers to be as educated as possible as to how to weigh their options and how to ask the right questions in order to receive the best possible care. And I think, unfortunately, there are some bad apples out there, and that's the reality of it, and that's how it is in every industry. But organizations like ACHC, it's our job to identify, where those are and try to help as much as we can, because again, ultimately, in the end, regardless of all this, it is the patient that is at the end of all of this that is our primary concern, that we hope and are assuring is getting the right level of care. So.
Well, good. Well, that was an excellent answer, Matt, and I want to thank you very much for your time today. I think I'm agreeing with you 100% that we really do need to educate more, and that's what we're doing here. So you have a wonderful rest of your week, and thank you for joining us today.
My pleasure. Thank you so much.
Thank you so much for listening today, and a special thanks to our sponsors and partners, Access, National Association for Home Care and Hospice, and Core Cubed. You can find more on our website, helpchoosehome.com, and on social media. Join us, won't you, to spread the word and help choose home when care is needed.